Knee Arthroscopy, Introduction. Can you point to the meniscus? Choose one of the following options. Correct. The meniscus is a shock-absorbing smooth material that allows smooth, painless knee movement. Which one of these knee joints is damaged or diseased? Choose one of the following options. Correct. A diseased knee joint has rough surfaces. The surfaces of a normal knee joint are very smooth. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous. Even though they are unlikely to happen, they can rarely cause death. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, however, a blood clot can go to the lungs and cause death without giving any other symptoms. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, as well as bleeding and scarring, may occur. It is impossible to injure the nerves and blood vessels going to the leg in this operation. Select true or false. Correct. It is very unlikely, but not impossible, to injure the nerves and blood vessels going to the leg in this surgery. Although these risks are rare, they can still happen. The operation tends to be very successful. Select true or false. Correct. The operation is nearly always successful. However, complications may still happen.
Thank you for using Explain.